All right, Patrick, Fiona, are we good to go from your perspectives? Good to go? All right, everybody ready? Let's light this candle, yeah? All right. I'm Adam Ruben. I'm the Director of Economic Security Project Action. Thank you all for joining us here today. H.R. 1, the partisan budget bill passed over the summer, is rocket fuel for America's affordability crisis. Millions of people across this country are already struggling with skyrocketing prices for groceries, for electricity, for housing, and now healthcare costs are crushing families. Trump and Republicans have slashed Medicaid and the Affordable Care Act, sending premiums through the roof. Instead of offering them relief, this partisan bill will slam over 22 million Americans with outrageous, hugely expensive new healthcare premium hikes. 22 million people will see their healthcare costs nearly double this fall as a result of this bill. And over the next few years, 15 million people will lose their health insurance. This means fewer families can afford health insurance, all to pay for massive new tax cuts for billionaires. It's a betrayal of hardworking Americans. We need affordable health care, better quality, lower costs, life-saving drugs accessible to everyone. The good news is that Congress has a chance to make things right now. Representative Adam Gray has led the introduction of a bill to protect health care and lower costs for all Americans, because we need more health care. We need better health care, not less health care, and certainly not to pay for tax cuts for billionaires. And the folks across this country can't afford another sky-high bill. So we're here today to call for bipartisan unity to defend health care and bring prices down for working families across this country. I'm happy to introduce Representative Adam Gray of California to talk about this plan. Thanks very much.
Good morning, and thank you all for being here today. Thank you to our guests who have joined us to share their experiences. I look forward to hearing from them here shortly. Thank you to our friends at the Economic Security Project for their work today as well. Nearly 71 million Americans rely on Medicaid for their health care coverage, and they are facing cuts to their care and increases in their monthly premiums. Employers are already anticipating that they will have to raise the cost of health benefits for their employees next year. Prices are too high already. And the budget bill that the president signed into law isn't helping matters at all. I want to be clear on this. These cuts and these price hikes are a direct result of the Republican majority's choice to pass a strictly partisan budget bill. These cuts mean longer wait times at the emergency room, higher costs for treatment, longer drives to the doctor's office. In rural communities like mine, where more than half of my constituents rely on Medicaid for their health coverage, we will face clinic and hospital closures, increases in monthly premiums, and working families will be forced to go without care. The Protecting Health Care and Lowering Costs Act would reverse the Medicaid cuts and extend the Affordable Care Act's premium tax credits to prevent a spike in health care costs and protect health care for all Americans. Next to housing, health care can be the next largest line item in a family's monthly budget. It's essential that we bring this legislation to a vote immediately to protect access to care for millions of working families. I urge my colleagues on both sides of the aisle to join me in supporting this legislation and showing the American people we're serious about lowering their health care costs and protecting their coverage. Up next, I'd like to introduce an incredible leader within our caucus, a fellow Californian, Chairman Aguilar.
Good morning, everyone. I want to thank Congressman Adam Gray and the Economic Security Project for hosting our event today, and the brave individuals behind me here who will share their stories about their experiences with health care in our country. As you know, earlier this summer, Donald Trump led Republicans in passing the Big Ugly Law. This administration's signature achievement gives tax cuts to billionaires like Elon Musk and Jeff Bezos by taking food away from hungry children and ripping health care from people who need it most. Republicans know how unpopular and cruel this legislation is they've spent the last week attempting and failing to rebrand this bill as something centered on workers instead of the elites that it truly represents. But the American people are too smart for that. They know that the big ugly law is making our country, our economy, and our society weaker. Democrats know that it's too late, that it isn't too late to protect Americans' health care, and that's what this effort is about. We just need a handful of Republicans to join us in undoing the damage that they've inflicted, and that starts with legislation like the Protecting Health Care and Lowering Costs Act. This bill would reverse the cuts to Medicaid in the big ugly law and permanently extend the ACA premium tax credits that have been a lifeline to so many families like those in my district. Right now, nearly 400,000 people in my district depend on Medicaid or receive a premium subsidy. Unlike Donald Trump and Republicans, Democrats are laser focused on making life more affordable for hardworking families so they can succeed, not just get by. I look forward to working with each of you in order to get this done. Thank you so much for being here, and thank you, Adam, for your leadership.
Thanks very much.
Thank you.
Next, I'd like to bring up Representative Frank Pallone of New Jersey.
Thank you. Thank you, and let me thank Adam Gray and all the sponsors here and the various groups that are supporting his bill. The Republicans have created a health care crisis with their big, ugly bill. I don't know how anything could be more cruel to the average American than what they've done in cutting Medicaid, in refusing to extend the ACA tax credits. I mean, I'm back in New Jersey, and the filings that have already had to be in place for the insurance companies for our marketplace have already been made in August. And the media has been drawing attention to the fact that for many people who maybe now are paying only $100 a month for their marketplace ACA coverage, may end up paying $300 or $400 a month and will not be able to afford it, and therefore will go without health insurance. And the same is true for the Medicaid cuts. We're seeing hospitals close, we're seeing community health centers close, particularly in the rural areas of the country. So this idea that this may not happen right away, this is happening now. The crisis is now, and you're seeing this as we speak. So all we're saying in this legislation is end this health care crisis. Get rid of these Medicaid cuts that were in the big ugly bill. Address the ACA tax credits that need to be put back in place. I would make them permanent, which is what this bill actually does. And I have to tell you right now, I know all the discussion is about the spending bill and what's going to happen by the end of the month. I'm not voting for any spending bill that does not address this health care crisis in a serious way. We owe it to the American people to address this. It's an affordability issue. The biggest problem that people tell me about affordability is the inability to pay for health care costs because they keep rising. And this bill is the answer. Let's get it passed. Thank you again. Now I'm supposed to introduce, I believe.
I got it.
Oh, you're doing it? Okay. All right.
Thanks so much. Now I'd like to introduce Philippa Pham Hughes, who is a writer and artist here in DC who's experiencing a significant rise in her health care costs.
In 2013, I was diagnosed with breast cancer, and that year-long treatment would have cost $150,000. I paid $3,000, and that's because I had health insurance. I'm a freelance artist and writer, so I pay for my health. I've always paid for my health insurance out of pocket. I don't work for a company, and I still don't work for a company that pays for it for me. And, you know, I've always thought it was necessary to keep paying these premiums. It has given me the options that have allowed me to make life-saving decisions. I remember paying about $300 or $400 a month at that time, and that seemed like a pretty high amount of money to be paying out of pocket, but it felt like the responsible thing to do. Having health care insurance meant that I could have regular checkups, the kind of checkups that would allow me to detect this disease early, which is why I'm here to be able to talk to you today. It has meant also regular follow-up care, which means that I can stay cancer-free. But as you know, the affordable, since then, the premium for my health care has gone up substantially, significantly every year. So right now, my annual, my monthly premium is $1,100 a month. But because of the tax credit, I pay $723. It's pretty high, but I think it's a necessary thing to ensure my health, to ensure my ongoing health. But last month, I got this email from the DC Health Insurance Marketplace, and it said that the tax credit is ending this year. And that means that I'm going to be paying double what I pay now. That means that 1/5 of my income is going to be going toward health insurance. And I simply do not know how I'm going to be able to afford paying 1/5 of my income to that. Having health care has always been a priority for me. It meant early detection, especially of a disease that is curable with early detection. It's meant that I haven't had to make, decisions foregoing treatment that I might not have been able to afford. And it means that I don't lose my home because of medical bills. So I'm expecting my health insurance to double next year, starting in January. And I just don't know what to do right at this point. I'm not going to be able to afford health insurance that once saved my life. I'm pretty outraged. I'm mad that Republicans have voted to drive up the cost of health care, all in service to give tax cuts to their billionaire buddies. Everything costs too much. Everything keeps going up in cost every single day. And Trump and his administration and the Republicans in Congress aren't doing anything about that. They're not doing anything to help average Americans like me. In fact, they're actually making things worse. So I'm calling on Congress to please help Americans like me have affordable health care going forward. And I thank our Congress people here today for doing that. Thank you.
Thank you very much, Philippa. I'd like to bring up Representative Gabe Vasquez of New Mexico. Thanks very much for being here.
Thank you. Buenas tardes. Thank you all for being here. My name is Gabe Vasquez. I represent very proudly the 2nd District in New Mexico, Southern New Mexico. And I'm proud to stand here today with my fellow Democrats in supporting the Protecting Healthcare and Lowering Costs Act. Thank you so much, Representative Gray, for introducing this pivotal piece of legislation that Americans need right now. Now, I co-sponsored this bill because so many folks in my home state of New Mexico need to see these Medicaid cuts reversed. And they know that these devastating Republican cuts to health care is literally a matter of life and death. And that includes my rural communities, and that includes my tribal communities in my district. And right now, due to cuts in this Republican tax bill, 38,000 people in New Mexico's 2nd District are at risk of losing their Medicaid coverage. The harm that's inflicted by these Republican cuts isn't just going to be limited to Medicaid. If the ACA enhanced premium tax credit expires under our watch, under Republicans' watch, insurance premiums are going to double for thousands more across the state who have private health insurance. That means that for over 50,000 New Mexicans, most of whom are already struggling to make ends meet, that's an average increase of $500 per month for healthcare costs. Now, in my district and in my state, $500 a month goes a long way. 50,000 people is a lot of people. Those aren't abstract statistics. Those are our neighbors, our friends, our family that are facing the real threat of losing access to the care that they rely on every day. And for them, losing coverage means going without life-saving medicine and care, skipping critical checkups, delaying treatment when it matters the most. That's not a choice that any American should ever have to make. Now, I've heard the fear in New Mexico firsthand. In June, I visited Socorro General Hospital, which serves rural communities across my district in New Mexico, and the staff and the medical director there spoke about the dangers of taking health care away and the repercussions that they would have to public safety and community health. And they especially highlighted the danger to expectant mothers in our state and our district. In New Mexico, over 50% of births are covered by Medicaid. Just last month, I also went to Carlsbad Medical Center in the heart of oil and gas country, one of the wealthiest places in the nation. And I heard from hospital leadership there about the harsh financial reality that they are facing. That folks who are relying on Medicaid are going to lose access to their health care. That they will no longer be able to afford preventative care that can prevent medical emergencies. And these are folks who are out every day on the oil fields, in the oil rigs, working to produce America's energy. This is about protecting families, keeping our rural hospitals open, ensuring that no one has to choose between their health and putting food on the table. And so let me make this clear. As insurance premiums go up, the entire healthcare system in this country feels the impact. Those are our tribal communities, our rural communities, our private ratepayers. This is going to have a domino effect that's going to ripple across this country. With this bill, we can reverse these harmful cuts to Medicaid, permanently extend the ACA tax credits, and prevent this preventable tragedy to the American people. Thank you, Mr. Gray, for introducing this bill. I'm proud to support it.
Thank you, Congressman Vasquez. Pleased to introduce Representative Angie Craig of Minnesota.
Thank you so much, and thank you to Congressman Gray for introducing this legislation. You know, I usually start an address like this by saying, it's great to be here, it's great to see you. But the unfortunate truth is that we shouldn't even have to be here right now. We should not have to be here protecting Medicaid in our country. We should not have to be here asking the majority to do what is right and extend the ACA tax credits. This summer, I was deeply disappointed when my Republican colleagues, who, by the way, control the House, the Senate, and the White House, so this is on my Republican colleagues, made the deepest cuts to the health care system in American history through their so-called One Big Beautiful Bill. Between the cuts to Medicaid and their failure to extend the ACA tax credits, as many as 17 million Americans are in jeopardy of losing their health care. Let that sink in for just a second. 17 million of our brothers, our sisters, our aunts, our uncles, 17 million of our grandchildren, 17 million Americans. I have always said that it's too expensive to be sick in this country, and that has never been more true. Having served on the leadership team of a major Minnesota healthcare manufacturing company, I know that preventive care not only saves lives, but it also saves money. Somehow that is lost on my Republican colleagues who voted to pass a plan that will not only strip health care from millions of Americans, but skyrocket the national debt in order to pay for tax cuts for billionaires. I don't have to tell the folks here today that health care is one of the biggest financial burdens on working families in our country. They literally cannot afford to pay for rising health care costs in our country. Working and middle-class Americans will die because President Trump and Republicans in Congress are more concerned with lining the pockets of billionaires than they are with taking care of the people that they represent. And just this week in Minnesota, we received word that 5 or 6 healthcare clinics are going to close as a result, in part, of the passage of the One Big Beautiful Bill. It's an egregious attack on working families in our country. But the folks up here, we are not going to betray the people that we represent. We believe, like most Americans, that access to health care is a right, not a privilege. That's why we introduced this bill, to repeal the Republicans' draconian health care cuts and deliver the promise that President Trump made but has not delivered on. In fact, he's done the opposite. He has not lowered cost for American families. While our Republican colleagues will continue working to enrich President Trump and his billionaire allies, we will keep fighting for the country where parents don't have to choose between taking their kid to the doctor and putting food on the table. And with that, again, I'm so grateful to be here. Thank you to everyone.
Thank you so much. I'm pleased to bring up Fari Ghamina Tumpe, who's a grandmother here in D.C., raising children with support from Medicaid.
Thank you. Jambo Bwana, everyone. To my esteemed brothers and sisters of Congress and all of our amazing speakers, thank you for being healthcare heroes. To the Economic Security Project, to the press and everyone gathered here today, from the bottom of my heart, I thank you. I am Fari Ghamina Tumpe, an activist, agitator, and advocate with Community Change Action, where we build power from the ground up. I'm a very proud native Washingtonian here on Capitol Hill, still living in the home where I was born, building community all my life, continuing the legacy of my grandmother and mother, helping to raise children in the community, teaching performing arts, and feeding those who hunger. I worked for decades, and now I depend on SSI disability, Medicaid, and Medicare. I am also a 3-gen caregiver of my adult daughter that has schizophrenia and her 3 differently able children that range in age from 4 to 16 with conditions of autism and other social and emotional learning disorders. And I, too, am a healthcare hero. But some days, I don't feel like being a healthcare hero. And many days, I don't want to be a healthcare hero. I shouldn't have to be a healthcare hero in the richest country of the world. Martin Luther King Jr. spoke of the civil rights movement, and he stated, "The urgency is now." To have Congress restore health care and prevent looming Affordable Health Care Act premium spikes. The urgency is now. To stop snatching health care from 22 million Americans and shutting down 465 rural hospitals. The urgency is now. To end tax breaks for billionaires to the tune of $1 trillion, the urgency is now. There are only 800 billionaires in the United States of America, yet 340 million will suffer at the hands of Republicans in Congress who might pass this atrocity, this cardinal sin against humanity. The big, beautiful bill that Trump and his 800 billionaire friends is trying to pass is unfathomable. The people demand a caring economy, and the people will move its money and its votes until we live in a caring economy. And make no mistake about it, the power of the people is stronger than the people in power. We will stage global economic blackouts if Republicans do not fund health care. We will choke the flow of money and remind them of the truth that the people are the economy. We are the economy, and that we are in power. Health care is a human right and not a privilege. And Republicans, you need to know that the people are behind you if you stand up to Trump's authoritarianism. The administration has waged war against its own people. It's time to end this dystopian nightmare where there is great suffering and injustice. Republicans, I invite you to close with a future-oriented question. What is the story you hope people will tell about you when you're gone? The story I hope people will tell is how I lived to be one with the will of God, how I pushed people to be their best selves in spite of their circumstances. Can we have one moment of life that supersedes politics? Because the urgency is now. Thank you.
Now I'm calling up Representative Stephen Horsford of Nevada. Thank you, Congressman.
Thank you. Good morning. I am Congressman Stephen Horsford. I represent Nevada's 4th Congressional District, which includes Las Vegas and 50,000 square miles throughout central rural Nevada. And I want to thank Congressman Adam Gray for his leadership and the Economic Security Project for hosting this press conference and bringing attention to really the most important issue of our time. Healthcare is a fundamental human right and an economic necessity. We know, because we listen, the people of my district and the people all across the country are scared right now. They're scared because Republicans have cut health care to the bone to fund tax breaks for corporations and the ultra-rich. Republicans have gutted Medicaid, and now millions of people will feel the impact. Families who depend on it for doctor visits and prescriptions and critical care will be left struggling. And now, with advanced premium tax credits, these are tax credits, not subsidies. They gave tax credits and tax cuts to billionaires, but they won't give it to working families to keep their health care. These tax credits are set to expire at the end of the year. And the fact is, we're already too late because premiums are starting to go up. And as a result, millions of families could see the cost of health care skyrocket. That's why I'm proud to be a co-sponsor of the Protecting Healthcare and Lowering Cost Act. And as a member of the Ways and Means Committee, I will continue to fight and to work to push these priorities forward. Now, the advanced premium tax credits are actually a point of pride, because when Democrats were in the majority, when we controlled the House, the Senate, and the White House, what did we do? We put health care first. We fought hard to create them within the Affordable Care Act, and we fought hard to extend them in the Inflation Reduction Act, where more than 20 million Americans now have affordable medical coverage as a result. In Nevada alone, 85,000 are covered through these tax credits. That's 85,000 people who will have to make impossible choices about whether to pay for meals or medicine if these tax credits on their health care are allowed to expire. For a family of 4 earning about $64,000 a year, their premiums could increase by 193%. That's more than $2,500. Meanwhile, they just gave tax cuts to billionaires and to big corporations on the backs of working people. And a 60-year-old couple earning $82,800 a year would see an increase of $14,257. That's over 200%. That's why I tried to amend the Republicans' big ugly law, the tax scam, to extend these advanced premium tax credits. But they stonewalled me at every turn. And now these tax credits are set to expire. If they refuse to act, if Republicans here in Congress refuse to act, millions of Americans will lose coverage, premiums will spike by as much as 17%, and rural communities like the ones that I represent would be hit the hardest. There's no way to put a positive spin on this, but it's too late. It's actually not too late. Republicans still can do the right thing by joining
with us in a bipartisan approach to restore the funding to health care, to restore the cuts that they made to Medicaid, and to extend these advanced premium tax credits. That's what my constituents deserve. That's what the people of America deserve. That's what we're working for today, and I'm proud to join with all of you in that fight. Let's keep up the work.
Thanks very much, Congressman. I'm happy to bring up Geneva and Rob Stone, who are healthcare and disability rights advocates with the Little Lobbyists. Can you stand here while you talk?
Yes, I will.
Okay.
My presentations.
Do you want me to move this over down there?
Rob activates this with his eyes. Takes a second outdoors.
My name is Rob Stone. I use he, him pronouns. I'm here today to represent Little Lobbyists. I'm an artist and advocate for healthcare and disability rights. I live in Maryland with my family. I am 28 years old, and I am fighting for me and other disabled children and adults to live with dignity in our communities. Medicaid home and community-based services are my lifeline, but congressional Republicans have slashed Medicaid funding. I want to live a fulfilling, independent life in my community. I should be able to control my own life, just like anyone else. I'm a grown-ass man and should not have to rely on charity or have to live in a facility. Republicans said they wouldn't hurt the most vulnerable people on Medicaid. Well, they lied, and they need to fix this.
I'm Geneva Stone, otherwise known as Rob's mom, and we're here to represent Little Lobbyists, a family-led organization that is devoted to advocating for children with medically complex needs and disabilities. Our kids need care, and they need Medicaid. Let me tell you Rob's story. Rob was born an apparently typical baby. At the age of 1, as if the brakes had been hit hard on a speeding car, going from 60 to 0 in 24 hours, Rob's whole body broke down and he was in the hospital. Our entire family was thrown into a skid that none of us had ever expected. During that first hospitalization, and for 14 years thereafter, test after test after test came back negative. Rob had no diagnosis, yet he had complex disabilities, and he was often deathly ill. Imagine this. Your seemingly healthy child becomes disabled and very sick overnight. Your life becomes a bewildering jumble of hospitalizations, doctors issuing diagnostic hypotheticals, therapists telling you stuff about your child's abilities that strike you as premature at the very least. But I refused to write Rob off. Private health insurance at that time became our lifeline. And wow, was it ever a hellscape. Because this was 1998, almost 30 years ago. Before the internet, smartphones, attached files, and the regular use of email. Before the Affordable Care Act. Before the Olmstead decision. And only 8 years after the Americans with Disabilities Act was signed into law. At the onset of Rob's unknown genetic illness, the Human Genome Project at NIH had just been launched. 5 years later, in 2004, NIH published the first complete human DNA sequence. 7 years after that, genome sequencing became available to families, and many of our families depend on that. And that's how we finally got a diagnosis for Robert in 2012 after 14 years of the need for really good health insurance. Robert was diagnosed with an ultra-rare form of dystonia Parkinsonism that affects about 50 people worldwide. There's still no single gene test for DYT PRKRA today. You have to have sequencing altogether. But because Rob never gave up, he doesn't, and we didn't either, Rob now has an experimental treatment, and he's thriving and better than ever. He finally has a Medicaid home and community-based services waiver that gives him funds for staff, transportation, and medical services and supplies that private insurers rarely cover. And he has a girlfriend. He wanted me to tell you that. But over the course of these last 8 months, every part of the healthcare system that has kept Rob alive for nearly 30 years, health insurance, medical research, Medicaid, has been slashed and burned by this administration. For me, it's like watching Rob crash all over again, except this time, it's everybody. I don't want to go back to 1998. Why Republicans want to destroy our healthcare system makes no sense to me. I was born in 1964. The version of America I grew up with was like Star Trek, to boldly go where no one has gone before. Progress, progress, and more progress. So why do Republicans want to go backward? Thank you.
Thank you so much, Geneva. Next is Representative John Mannion of New York.
Thank you to Congressman Gray for this important legislation and having me here today. I also want to speak to Rob Stone and Geneva Stone here. I come from Syracuse, New York, Central New York in the Mohawk Valley. We are caring people, we're a caring community, and I was proud to chair the New York State Senate Standing Committee on Disabilities for 4 years. Medicaid and state and federal programs are essential to providing the highest level of independence that individuals can have. We all need supports. Some of us need individualized and specialized supports. With those supports come independence, and with independence come dignity. So when we cut Medicaid and we cut other essential programs around this country, instead of independence and dignity, we have some very serious ramifications. Those ramifications are isolation, homelessness, incarceration, and sometimes death. That's what we're dealing with. This is a life or death matter. In Central New York, we have a robust healthcare system. We are blessed to have that. But we also serve a very large geographic area. One of our larger providers has the only emergency psychiatric care facility in the county. They are mandated to keep those doors open as the only one. They lose revenue year after year after year. And when I speak with the good folks that work in that facility, they talk about the difference of being covered, being on Medicaid, and not. If someone has an acute psychiatric emergency condition that occurs, they are going to see them whether they have health insurance, Medicaid, or not. The difference is that if they don't have Medicaid, that costs get pushed on to other people, which of course is all of us and is a serious concern. But just as importantly, when they care for that individual and that person walks out the door, if they've got Medicaid, they will have follow-up visits. They will have appropriate medication, which will keep them from having another challenging event. So that's really the difference. The difference is, do we abandon that person when they walk out of the door, or are we true to our values and our norms as a country, and do we stand with them and do we support them? I thank you again for having me here today. We continue to fight together. I thank all of my colleagues and the advocates for sharing their stories. And with that, I will pass the microphone on to my esteemed colleague, Dr. and Representative Kelly Morrison from Minnesota.
Good morning. Thank you, Rep. Gray, for hosting us and for your leadership on this important issue. I'm Kelly Morrison. I represent Minnesota's 3rd District, and I've had the honor and privilege of caring for patients in Minnesota as an OBGYN for more than 20 years. And I think about my patients every single day that I am here in Congress. And wow, I've had a lot of reasons to think about them even more this year. Because what Republicans have done with their total majority control of the United States government is to put health care out of reach for as many people as possible. For making the single largest cut to health care in our nation's history with their cruelly named One Big Beautiful Bill, to kicking millions of Americans off their health insurance, to now jacking health insurance premiums for tens of millions of Americans across the country by triple digits, literally as much as 218% by some estimates. This is their health care plan in action. This is Trump care. Less access to care, less affordable care, more chaos and confusion. And as a doctor, I have to tell you, I find this unconscionable. Taking away people's health care, gutting Medicaid, skyrocketing premiums, pricing families out of coverage. These are horrible policies, and they also have extremely dangerous ripple effects that will affect all of us. I've spent a lot of time this year meeting with patients, healthcare providers, hospitals, clinics, and they're saying the same thing we're hearing from everyone across the country. They are terrified. What the Republicans have done with their One Big Beautiful Bill will mean that hospitals and clinics will be forced to close. Others will be forced to reduce services. And what I always remind people is, it doesn't matter if you have Medicaid or not. The Republicans' cuts to health care will affect you. They will hurt you too. It will hurt everyone, because it doesn't matter what insurance you have if your local hospital or clinic no longer exists. And the Republicans' health care plan will force families to lose their health care coverage, which means those families will seek less care. They won't be able to afford their medications. Even if you don't personally lose your health insurance, increased uninsured rates will hurt you too, because it'll mean a spike of ER visits and longer wait times. It'll mean more uncompensated care and more unworkable burdens on our hospitals. This will only make our country sicker and worse off. And just to take a step back, making more people in our country uninsured, what are we doing? What are we doing? Nobody wants this. The only reason we're in this position is because Republicans chose to give tax cuts to the wealthiest among us and large corporations over Americans' health care. It's unconscionable. It's frankly immoral. That's why I'm standing here with my colleagues, with my patients always on my mind, demanding that we reverse these devastating cuts to Medicaid and permanently extend the Affordable Care Act premium tax credits. That's what the Protecting Healthcare and Lowering Costs Act of 2025 does. It's honestly the bare minimum of what we should be doing in Congress to address the healthcare affordability and accessibility crisis in our country. Democrats were united in opposing these cuts in the first place. And now we call on every Republican to listen to what patients, healthcare providers, hospitals, and clinics across this country are saying and deliver for the American people. This should be a no-brainer. It's what the American people need and deserve. They must do the right thing and put the American people's health first. Thank you.
Now I'll introduce Dr. Elena Callender, a physician. I'll hold your sign for you.
All right. Good morning, and thank you everyone for being here. Thank you to Congressman Gray for your leadership and for creating the space for frontline voices to be heard today. Again, my name is Elena Callender. I am an OBGYN physician currently practicing in Maryland and Virginia. I'm also here representing Doctors for America, a national organization of more than 40,000 physician and medical student advocates committed to putting patients over politics. I've spent the last 19 years caring for patients through some of the most critical moments in their lives, through adolescence, pregnancy, childbirth, and beyond. What I can tell you is this: when people lose access to health care, the consequences are immediate and devastating, especially for women. And I've seen this when I've seen patients all throughout the years. Right now, thousands of women across the country are at risk of losing access to essential care. Some are newly pregnant and won't be able to continue their prenatal visits to keep their pregnancy healthy. Others may be in the middle of treatments for diseases like cancer and may have to choose between continuing treatment or keeping the lights on at their home or being able to feed their children. I've seen what happens when patients fall through the cracks. It is not just dangerous, it is life-threatening. And unfortunately, it's not uncommon. If these healthcare cuts are allowed to move forward, millions of Americans will be pushed off of Medicaid, and millions more will see their ACA premiums spike beyond what they can afford. That means fewer people getting screenings and preventative care, and fewer people having access to treatments that they need that may save their lives. This is more than just bad policy. It's a public health crisis in the making. Access to healthcare shouldn't depend on your income or your zip code, and it certainly shouldn't be sacrificed to fund tax breaks for billionaires. We have a chance now to do the right thing. We can defend Medicaid, lower costs, and protect the health of our communities. And I am happy to see this representation here of our congressmen and to see all of you here, and I appreciate you being here. And I want to just say that we need you to fight. We need you to fight for our health care. Thank you.
Thank you. Now I'm inviting up Representative Mary Gay Scanlon of Pennsylvania.
Thank you. Good morning. I'm Mary Gay Scanlon. I represent Pennsylvania's 5th District, which includes Philadelphia, where 1 in 6 doctors get some portion of their training in this country, and then some of our surrounding counties. You know, ACA tax credits and Medicaid funding ensure that Americans can afford quality, comprehensive health insurance coverage. I'm here today and I've joined Representative Gray's bill because this is something that Congress can do something about right now. Next week, we could fix the problem we're facing today. It can take time to address inflation. It can take time to build a clean energy economy. It can take time to onshore manufacturing. But this is a self-inflicted wound caused by the big ugly bill, the cuts to Medicaid, and the failure to renew the ACA tax credits. The fact of the matter is, healthcare in America is already expensive and inaccessible for many because of insurance premiums and out-of-pocket costs. 24,000 people in my district, 24,000, rely on the Affordable Care Act tax credits. Over 176,000 rely on Medicaid. Across Pennsylvania, the numbers, of course, are higher. But those people are going to lose coverage because penny enrollees, that's our Medicaid and insurance marketplace, penny enrollees will see an average insurance increase of 82% because of these tax credit expiration. Even if you don't get coverage through Medicaid or the Affordable Care Act marketplace, the ripple effect of the big ugly bill have already started. Insurance companies have already started increasing premiums nationally, and the impact of those cuts are going to affect our healthcare system from wait times to hospital bills. We hear a lot about how rural hospitals will close across our country, but all hospitals across the country will suffer as a result of these cuts, and particularly frontline hospitals in our urban areas. I've had 3 hospitals close in my district in the last couple of years because of pre-existing issues with respect to Medicaid reimbursement. It has burdened other providers in our area to absorb the increased demand for health care. So instead of alleviating those barriers to receiving quality health care, our Republican colleagues chose to make it even harder for Americans to access health care by imposing more red tape and work requirements that are going to end up kicking people off their health care. I'm proud to stand with my colleagues in support of Congressman Gray's bill. I'm proud to be joined by an advocate from our district, Mayor Deutsch, from Narberth. I thank her for being here today, but this is something that Congress can fix and can fix now because Congress is the one that broke it. So I urge all of our colleagues to join us on this bill, and thank you for sponsoring it today.
Thank you. Andrea Deutsch, small business owner and mayor of Narberth, Pennsylvania.
Thank you. Hey, everyone. My name's Andrea Deutsch. I wear a lot of hats. I'm a small business owner. I own a little pet store that I've owned in Narberth, PA for 22 years. It's a great store. I love doing what I do. I'm also the mayor of Narberth, PA, and I love doing that as well because I love being able to help my constituents solve problems because I like to solve problems. I'm also a type 1 diabetic. I was diagnosed at the end of 1968, 56, almost 57 years ago, at the age of 15 months. Diabetes is an expensive disease. It's even more expensive if you don't treat it. So I have to have health insurance. It's a necessity for my life and my ability to have a quality of life. Thanks to the Affordable Care Act, I can no longer be discriminated against as a person with diabetes. Thanks to the enhanced tax credits, I now pay approximately $700 a month for my health care, which would ordinarily be priced at over $1,400 a month. If I lose those tax credits, that is a big jump. That's a big jump in monthly payments. And I've also received notice already from my insurance company that the rates are expected to go up between 17 and 20% next year. Doing the math, that's a lot of money. It's a lot of money for a little pet store owner who's trying her best to make it every month. I'm not alone. A lot of my constituents, the mom and pop shops in my town, the little restaurants, the little, toy stores, the bookstores, we all have to pay health insurance, and a lot of them are on the marketplace. A lot of them will suffer. There are also early retirees in my town that will suffer. People will suffer. The money that we don't get from the tax credits, that $700 a month, that helps me enhance my store. It helps me get my products and serve my customers. But it also allows me to live a very modest lifestyle where I help support the shops in my town and the quality of life. This is all tied in. It's all tied in. There is a butterfly effect to taking away these premium tax credits. So I would urge Congress to continue them and continue allowing people to get health care and afford health care, because at some point the insurance premiums are going to go up so high I won't be able to afford them, and we're getting close. And I will have to close up my shop that I've loved having for 22 years and go work for a corporation that can, if I can get a job, if everybody else is looking for a job in the same circumstances, and it will let me lose a dream, something I've worked for decades. I would ask you to Congress to make these tax cuts permanent. I would ask that the small businesses and the people who run them in your towns be able to have some security, knowing they're planning their future and that they can continue to have health care, and that we just continue to keep this country healthy and well. And I thank Congressman Gray and my Congresswoman and all the Congress people standing behind me who are standing for people's health. It's very much appreciated, and let's get this done.
Thanks, Andrea. I'd like to bring up Dr. Leighton Koo, Professor and Director of Health Policy Research at George Washington University.
Thank you very much. Thank you very much. As mentioned before, I'm Leighton Koo. I'm the Director of the Center for Health Policy Research at George Washington University. And my colleagues and I did some rigorous research about the implications of some of the legislation that they're talking about today. And so I thought it's worth sort of mentioning some of this. We've heard about the healthcare harm that can happen, how 14 or 15 million people might lose their health insurance, how patients like some of these here, caregivers and physicians can be harmed. We really tried to look at this. The underlying logic behind this sort of expiration of the ACA tax credits and of the deep Medicaid cuts that are in the One Big Beautiful Bill were Republicans said they needed to cut federal spending. This was going to strengthen the economy and was necessary. But what our research shows is that, in fact, these cuts create a wrecking ball for not only health care, but for the economy in general. And so let me give you a sense of what happens. When we take away billions and billions of federal dollars that support health care, the first hit is to healthcare providers, to hospitals, doctors, pharmacies, nursing homes, etc., that provide care to patients like these. And so that's the first line of cuts. But after that,
the cuts ripple through because healthcare providers need to cut staff, cut expenses. That means that these cuts ripple through to the rest of the businesses that are in their communities that sort of end up having that overall negative effect. So let me just highlight the findings of our studies. It's going to happen soon when the ACA tax credits expire beginning in January. At that point, $26 billion in federal funding that supports these tax credits will go away. The implications of this, however, are that state economies will lose around $34 billion. That is, the cuts to state economies are about a third higher than the federal funding savings, and that's because of the ripple-through effect of this. So again, it's not helping economies, it's hurting economies when you take away these funds. In addition to that, we know that and so that's coming up next year, around 300,000 people will lose their jobs because of this. About half of them are in healthcare, so they're in doctors' offices, hospitals, pharmacies, nursing homes, etc. But the other half are in all sorts of other sectors of businesses that are in the supply chains that help provide healthcare, their employees, and our consumers, just like you and me. So again, these repercussions are cut deep. In addition to this, state and local tax revenues will fall by about $250 million. So then what happens as we proceed into the Medicaid cuts that are part of the One Big Beautiful Bill? And I will say we've done some research about this. We haven't published it yet, so you're hearing it for the first time here. So when we do these analyses, in a few years we're going to see $90 billion in Medicaid funding taken away. That's federal funding. The repercussions of that are that, in fact, what will happen is, once again, about a third more is lost from state economies. Around $118 billion will be lost out of state economies. And so the net effect is, at that point, we're talking about 1 million more jobs that will be lost. Once again, about half of them in healthcare and the half in other sectors of the economy. So, the notion that somehow doing this was helping the economy, was helping things, that's just not right. In fact, what these things do is they create a wrecking ball that hurts healthcare, and that ripples out to affect other parts of the country. So once again, the legislation that Representative Gray and his colleagues have been talking about here are trying to say, let's not have this wrecking ball hit. Let's not protect healthcare. Let's help the patients. Not only help the patients, but help the providers, and ultimately help the economies of the states and the people who are employed. We don't need, at this point, and when we're seeing a weak economy already, we're already seeing problems with employment. Do we really need to see about 1.3 million jobs lost in the next few years because of the One Big Beautiful Bill? I don't think so. Thanks.
Well, thank you to all my colleagues for joining me here today, for all of you sharing your personal stories. Mayor, my little sister had type 1 diabetes and was diagnosed at 2 years old. I'd watch my mom sit on the phone trying to make sure she had supplies. And it certainly doesn't make America great again to sit on the phone longer, to have less care, to have less coverage in rural communities. And this is an important action. Many of my Republican colleagues wrote letters, stood on the floor, spoke of the importance of not making cuts that would decimate rural health care. Well, now we have an opportunity to put our money where our mouth is. We have an opportunity to support legislation to reverse those cuts, to make these tax credits permanent, and to take a step in the direction of making health care great again. So thank you all for being here. Thank you for the folks that helped put this together and put in the time to talk with the folks out in our community and get these stories told. On to passing this bill and getting the votes and doing the advocacy necessary to protect health care for all Americans. Thank you.